So I'm going to go through the activity as part of activity for lab number 2. And so I want to go through it and just show you how to palpate those particular structures. So when you do practice on yourself, you'll be able to locate where these are and where they live. Or when you palpate them on a partner, you'll have a reference point. The activity sheet does make reference to use the trail guide and also Lippert. I think those are two really good resources, but I think if you follow along with me, this will help you quite a bit in terms of just locating where these structures live. Be gentle when you palpate. You don't want to poke in directly like this. Use the sides of your fingers. It's a lot more gentle and will produce less of a painful response. These are sensitive structures. There's nerves, a lot of nerves that live in this area. And there are also muscles that work really hard and that are often stressed because of the work they're doing in terms of supporting the structure of our head, which is really a pretty heavy little bowling ball. Which is a good thing, and your skulls are all nice and heavy because they're filled with all the wonderful brains and neurons that are just lightening up. Okay, so let's start with the occiput, and I do have the model here of a skull. So you all have taken anatomy, so you know where the occiput lives. It's right back here, and it's right in the back of the skull, and what lives there is the subocciput muscles. And what those muscles do is they help extend the head, and they also help us rotate to the side. And they can be really tight. So to feel those muscles, you really need to put your hands, in the back of the skull, right down and in, and you can feel them, especially as you bend down these little bitty muscles, and you can maybe give them a little bit of massage to feel them, and this is an area that can be very restricted on people. And there's a technique called subocciput release, and when we meet in lab for 104 lab in person, we'll get a chance to look at those muscles. So the mastoid process, what's important to know is that you're at the right place. So this is the mandible. It's not there. Okay, it's that nice little bony part right back here, right below the ear. So on me, it's pretty prominent. I can just feel it. So I'm not on the jaw. I'm right back in here, right below the ear. And it's pretty prominent. I can really, really feel it. It's a little bit tender. So be careful as you palpate it. But just think about where it lives in terms of where the skull is. It kind of wraps around. And it's right, that little bump. Right there. Okay? So stay off this. If you're here, you're at the wrong place. But if you follow the occiput and travel it around, you'll feel that nice little bump, and you're like, ah, I feel it. So it's a nice little tricky bump, but you can just go right up below the ear, the lobe here, right behind it, and you'll feel it. Really prominent. Okay? So that can also be really, really tight and restricted too. And it's a sensitive area. And it is an area that we treat. Sometimes we work into the TMJ joint. So the TMJ joint, here we are, the mandible. We talked about this. This is this. And then the temporal bone is right above it. The temporal bone, and then we have the temporal lobe of the brain that lives inside there. So if you think about it, here's the mandible, and then right above it is a temporal bone. So this joint is what is helping us do things like controlled opening. So if you open your jaw, you can feel it working. Here's the mandible, and right above it the articulation with the temporal, and you can feel it. You can do a controlled opening. And TMJ, we call it putting the tongue in the roof of your mouth and control. So what we see sometimes with people with TMJ problems is this. There's no joke. You see that lateral deviation? And so we do controlled openings as an exercise. Again, you can feel that little joint working. So it's a very important joint, a little sensitive in there. And people that have dysfunctions of the TMJ joint will often lock up in this joint and have quite a bit of pain, and they'll pop their jaw sometimes in the morning to help temporarily resolve the pain, but it just creates more of a dysfunction when you pop your jaw. So the next is the cervical spinous processes. So this would be going back to anatomy, and you have bone boxes that you can have access to check out, but this is a transverse, they're in the back. And so if you palpate on yourself, I have a really big one right here in the C7, and you travel all the way up, you can feel those transverse processes. Okay, you know, these are important areas of the spine. They provide protection, so that's really important to know. They help protect our spinal cord, so they provide a real structural protection element to them. And there's also these little muscles that attach back there as well. So the next would be the we've got the spinous processes. Transverse processes are on the side. Okay, I don't think it asks you to find those, but they're not hard to find really. But you can find the spinous processes and go on the side and go just kind of deep. You can feel them. These little bumps. I got it. These little bumps right back in here, and this is what we're talking about. These little bumps. So here's your spinous process. On the side is your transverse processes. Okay, transverse processes on the side. Again, right up through here, got our spinous processes in the back. The transverse, you can feel those little bumps as you go down. I know it's hard to see, but that's where they live. Important, right? Especially in the cervical spine, because you see those little nerves, and particularly the red nerve there. So these transverse processes help protect that area and help protect that nerve. So very, very important function. And you can see that little foramen there, and that's where that nerve is coming out. That separates the cervical spine from the thoracic spine. Thoracic spine does not have these cool little foramens on the side. All right, clavicle, collarbone, pretty prominent. You can see mine as I'm popping up there, right? There's my clavicle. I think we all know where that lives, and it comes around, travels, and it forms the AC joint on the side, and then articulates with the sternum, which is right in here. Okay, so here's our sternum, right in the center. And the first rib is kind of a funky one to palpate. Funky is the operative word. So my upper trapezius helps elevate my shoulder. So if I pop up like this, you can see my upper trapezius, right? And right underneath it, if you push straight down and it's hard, that's your first rib. So it's really hard, and it's not real comfortable. So again, upper trapezius, if I go right beneath it and push straight down, you got that first rib. Okay? The sternocleidomastoid muscle is one of my favorites. It's a wild and crazy muscle. It's a strap. Okay? So this is going to be helpful when you learn these stretches from me or Kat. Okay? So this is the function of it. It laterally bends the head. As I rotate my face, look at that sucker. I mean, it's huge. It just pops right out there. It's a nice, big, big muscle. So its origin is actually down here on the sternum and the clavicle. So it's kind of a strange little origin, right down through here. Again, side bend, turn away. There it is. Big, big boy. Big boy. And now you can really see it. There we go. And so the insertion is that mastoid process that we were talking about earlier. So as you side bend, turn away, you can really see it go all the way up there. So what does it do? It laterally bends the head and assists in turning the face the opposite direction. Or turning the head, but literature will say turn the face. Okay, so deep to the SCM, so if you kind of go deep in there, and again, be careful with your fingers so you're not getting into the carotid arteries. You don't want to be just like going around like that. You want to go behind, right? And you have the scalings. So just think of a fish and the scales of a fish to help it kind of breathe, right? Not just kind of, really, to help it breathe, the scales and the gills, right? So if you think about it, these muscles do help with breathing to some degree, but their primary function is to do what? Their primary function is to bend the head to flexion, neck flexion, then unilaterally to laterally bend the head like this. Okay? So if you do an isometric, and again your hand is deep to the SEM, and SEM, right behind it, okay? And if you do an isometric into cervical flexion, you can really feel it pop out. Like, whoa, your SEM will try to take charge too, but if you go deep, you can feel the SEM, or the scaling's working, which is really pretty cool. And then laterally, again, the isometric, you can feel them working to help side bend the head. So the origin is that transverse process on the cervical spine. Again, we're talking about these guys on the side, right? We found them up here. And the insertion is the first and second ribs. So they're long, they go straight down, and if you go straight down below the upper trap or inferior, that's where the scaling inserts. And again, if you isometric and side bend the head, you can feel those little guys popping out. Kind of cool. The SCM wants to take over, but they're working. I can feel them contracting. So that's it for now. Again, be gentle as you're palpating your family members or self-palpating. Again, don't push deep into those carotid artery area, or you could end up passing out. It's really, really important to be gentle. Know, again, the temporal mandibular joint is also tender, so be careful with that. Again, just look at the controlled opening. Temporal bone, mandibular bone, you got it. Mastoid, again, coming from the back. The occiput, you feel a little bump right below, behind the earlobe, right back in here. And then we talked about the SCM a lot, and then we talked about the subocciput being right back in here. All right.